We're going to turn now to a GMA health alert about daylight saving time. Early Sunday morning, most of us will set clocks back an hour, and while it's been a cause for political debate, some have suggested we should abolish it. Studies now show the time change also has potential impacts on your health. And our chief medical correspondent, Dr. Narula, is here with more. Okay, so talk to us about what's going on here with daylight saving time, Dr. Narula, and the impact on our health. It's nice to see you.
Nice to see you. Well, it sounds so wonderful to have that extra hour, but what if we told you that it was actually harmful? And that's exactly what most medical experts would say. How could that possibly be that a shift in time could cause potential health damages or risks? And that is because inside of all of us, we have this internal clock called a circadian rhythm, and that is finely tuned to the sunlight. That circadian rhythm controls our bodily cellular processes, digestion, our immune function, our metabolism, and so any sort of shift can throw that out of sync. So there's actually a Stanford researcher who had a great analogy that I loved. The circadian rhythm, he said, is like the conductor of an orchestra. The musicians and the musical instruments are like your organs. So anything that throws that conductor off is going to throw everything else off in terms of your symphony. So when we look at the health impacts, we've talked about the spring forward having risks of cardiovascular events like heart attack, stroke, traffic accidents, while fall back tends to also bring with it mental health issues, mood problems, appetite changes like an increase in appetite. And we know that it takes sometimes 7 days to weeks for us to really adjust. Most other countries do not have daylight savings times. Hawaii and Arizona does not. We have tried to get this pushed through Congress for several years, but they have not accepted a bill to really have a standard fixed time, although most medical groups like the American Medical Association and the American Academy of Sleep Medicine think we should have a standard fixed time that really keeps us more in line with those early sunlight hours and darker in the evening time.
I mean, I was kind of looking forward to the extra hour of sleep, especially because Will and I are running that relay, the GMA marathon relay, so we do have to get up early. But how should people prepare for this, and how can they sort of regulate over time?
Yeah, we know that sleep is so important, and a third of Americans really don't get enough sleep. Most of my patients, when I ask them, say their sleep quality is really poor. So what you can do ahead of this is start to shift your bedtime 10 to 15 minutes later and your wake time 10 to 15 minutes later. Make sure that you're doing good sleep hygiene, so avoiding alcohol, large meals, caffeine right before bed. Get up early in the morning, get out in the sunshine, avoid bright lights or screens right before bedtime. These are some of the things you can try to do to prepare yourself for Sunday.
All right, we will do our very best. It's always a shock to the system, but you're there to help us plot our way through. Thank you, Dr.
And you're going to do great in the race.
Oh, thank you.
We're running daylight savings.
We're
3
jogging.
miles. Don't worry
We're
about
jogging.
it. It's a walk jog. It's a silent J. All right.